Viewing or listening to this podcast confirms acceptance of the disclaimer visible on your screen or found at authorscott.com/podcast. Welcome to the Regaining Health and Humanity podcast. I'm Dr. Scott Johnson, your guide on this journey to natural well-being. Here we explore evidence-based insights, revolutionary breakthroughs, and powerful health strategies that not only inform, but inspire change. Together, we'll uncover the mysteries of human existence and unlock the secrets to thriving. This podcast is more than just knowledge. It's your catalyst for unleashing extraordinary potential. Get ready. Your journey to boundless health and happiness starts now. Hello, friends, and welcome to the Regaining Health and Humanity podcast. I'm your host, Dr. Scott Johnson, and as always, I'm grateful you are listening and for your support. GLP-1 inhibitors are all the craze right now, and they are being primarily used for weight loss and metabolic regulation. However, the side effects of these drugs have caused people to search for natural ways to stimulate this same type of activity. That's why I've invited Dr. Lawry Han to the show, who has been researching natural GLP-1 agonists. Dr. Han is the founder and chief scientific officer of Alpine Biotech, a scientific research firm in the health and wellness space, and an adjunct professor of biochemistry at a Chinese university. He is currently pursuing his MBA at the University of Utah. Dr. Han has held executive positions with some of the biggest companies in the health and wellness space and managed approximately 50 technical and scientific professionals. He was elected to be a fellow of the American College of Nutrition in 2016 due to his outstanding contributions to the area of human health and nutrition. Over the past 10 years, Dr. Han has developed over 100 human health products, published 40 peer-reviewed biomedical research papers as lead or senior author, which have been cited 1,000 times by peer researchers. Dr. Han holds a PhD in biological sciences and a bachelor's degree in biological engineering. So welcome, Dr. Han.
Thank you, Dr. Scott. Hello, everyone.
So I want to jump right in because maybe not everybody knows what a GLP-1 agonist is. So what exactly is GLP-1? And how does it function within the body's metabolic processes?
Yeah, that's a wonderful question to start with, Dr. Scott. So GLP-1 is short for Glucagon-like peptide 1, right? In essence, it's a hormone that your body produces in the intestine that plays a very critical role in regulating blood glucose levels and appetite, right? Some people call this blood sugar levels. We tend to use blood glucose in the academia, but they're the same thing, right? So essentially, when you consume foods, especially carbohydrates like bread or other cakes or other things, and GLP-1 is released to stimulate your insulin secretion, which promotes glucose uptake by cells and thus reducing your blood glucose levels, right? GLP-1 also blocks glucagon secretion. Glucagon, again, is another hormone your body uses to raise your blood glucose levels when necessary. So GLP-1 prevents more glucose from going into your bloodstream by inhibiting this glucagon. Another thing to note is that elevated GLP-1 level can suppress your appetite. So you will eat less, and thus it helps with weight management, right? Because simply you eat less. And GLP-1 also slows your gastric emptying, and thus the foods you eat stay in your digestive tract longer. So they stay longer inside your body, so you feel more fuller, right? You feel this more satiety, and so you want to eat less. So taking together these actions make GLP-1 really essential for the metabolic processes, especially your blood glucose control and weight management.
That totally makes sense, given that the drugs primarily target glucose management as well as satiety and weight loss because of that mechanism. And you've kind of talked a little bit about how that works. Can you explain a little bit more about how GLP-1 agonists, or what their mechanism is in managing diabetes and obesity?
Yeah, definitely. So briefly set the stage, right? GLP-1 is a natural hormone your body naturally produces. Everyone does that, right? You, myself, everyone, every human in this planet. So it's a natural hormone. However, it has a very short lifespan. It's about 2 minutes. Right? It's only only stay that long inside your body. Right? In the pharmaceutical world, that doesn't really help your body that much. Right? So because of the nature GLP-1's rapid breakdown in the body, GLP-1 drugs. Here you use GLP-1 agonists, right? I'm going to use GLP-1 drugs throughout this context, right? So GLP-1 drugs were developed to mimic and prolong effects of the GLP-1 hormone, right? Mm-hmm. So essentially, GLP-1 drugs are similar compounds that are mimic real GLP-1's hormone, right? But they stay active for much longer time in human body. So that's really the beauty of these GLP-1 drugs compared to the natural GLP-1 hormone. Like a real GLP-1 drugs work by binding to GLP-1 receptors in the pancreas and your brain. So this binding increases insulin release only when blood glucose is elevated, which lowers the risk of the so-called hypoglycemia. Hypoglycemia means lower than normal level of glucose. That's the situation you don't want to get into, right? So these GLP-1 drugs really have this advantage, to lower the risk of hypoglycemia compared to other obesity or diabetes drugs like insulin. And GLP-1 drugs also block glucagon secretion, just like GLP-1 and natural GLP-1 hormone would do, right? So these GLP-1 drugs also suppress appetite, reducing hunger and slowing stomach empty, which contribute to weight loss and reduce the calorie intake. So it's just working very much similar to GLP-1 natural hormone, right? So this dual effect on blood sugar or blood glucose and appetite makes GLP-1 drugs really highly effective for managing both diabetes and obesity.
Yeah, it makes total sense. If you're just prolonging that activity that is normally found within the body, that we would see those positive effects that would influence obesity and also diabetes. One of the challenges that I'm seeing, and as I've talked to others who have prescribed these GLP-1 drugs, is some of the potential risks and side effects and dangers associated with them. What are some of those potential risks and dangers associated with the drugs?
We have to keep the context right? GLP-1 drugs are relatively new, and like any new medications, we're still learning a lot about their benefits and the potential risks and dangers, especially some of the long-term benefits and risks. And the most common side effects of GLP-1 drugs so far are digestive problems, right? Including loss of appetite and nausea, vomiting, sometimes diarrhea, and maybe constipation. Right? So those are the most common side effects of GLP-1 drugs, primarily digestive problems. There are also other side effects include muscle loss, dizziness, and increased heart rate, infections, and headaches, and indigestion, or sometimes we call this stomach upset. There are also some problem with the injection site, itching or redness, swelling, or even infection. Some other severe symptoms, side effects might include gastroparesis. Sometimes we call this stomach paralysis. It's pretty much talking about the symptom that movement of food out of the stomach is very slowed or even stopped. Some other severe side effects might also include bowel obstruction or blockage that keeps food from passing through the intestines. Other severe symptoms might include gallstone attacks and bowel duct blockage. There are some relatively rare, but severe side effects include pancreatitis, and sometimes acute kidney injury, or maybe even in some cases, thyroid cancers. So of special note, these GLP-1 drugs are not safe to take during pregnancy, right? Animal studies have shown that these medications can cause some really severe developmental problems in the fetus. So the bottom line is that, regular check-ins with a healthcare provider are always recommended to ensure the safe use along the process, right?
As I've talked to other practitioners who are recommending these drugs, I see that those that are worth their salt are doing this in cases where it's really one of the last options. They're not giving this just like candy and telling people, okay, take this and you're going to lose weight, because they need to also include things like adjusting lifestyle, and having some coaching on how to eat better and to how to improve movement in your life. And in what you're saying with those side effects are really what I've heard a lot too. Some of the ones that I'm most concerned about are the paralysis of the GI tract, and also the way that weight loss is occurring. Some of the practitioners that I've talked to have said that they're seeing a significant amount of muscle loss rather than fat loss, and that's the exact opposite of what we want to see in typical weight loss. Is you want to focus as much as you can on that fat and the water loss initially, and preserve your muscle as much as possible. Are there any long-term effects? I know this is a new class of drugs. We don't have a lot of data, like you said, but are there any long-term effects of using GLP-1 agonists for managing diabetes or obesity? And if so, what are they?
Yeah, definitely. I mean, you're right. I mean, there are just a lot of things we're still in the process of learning and finding out, right? The research so far already showed that those GLP-1 drugs have some really significant health benefits and also some possible risks that are still being studied, right? Let's talk about the long-term benefits first. So I would think there are probably three major categories, right? One will be exactly about the weight loss and the blood glucose control benefit. These GLP-1 drugs can help people keep weight off and maintain a healthier blood glucose levels, especially, as you said earlier, when combined with a healthy diet and the regular exercise, right? So many patients also find these drugs can help control their hunger, control their cravings, which is very beneficial because it's making it so easier to lose weight and keep diabetes in check. Another a second category I would say would be the so-called heart health protection, right? Some GLP-1 drugs have shown benefits for the heart. A study suggests that they can lower the risk of heart attacks and strokes in people, especially in people with type 2 diabetes. So this is likely because they help improve weight management, improve blood pressure, and improve their cholesterol level, all of which are important for heart health, right? We know that healthy weight, and healthy blood pressures, healthy cholesterol levels, always good for your heart health. The third category I would think would be the possible kidney protection, right? And especially for people with diabetes, and I would think many people know that, right? It's like the kidney problems can be a big concern, right? So GLP-1 drugs may help protect the kidneys, possibly because they help lower blood pressure, reduce blood glucose levels, and also reduce some of the potential inflammation caused because of diabetes and other concerns. And of course, more research is still ongoing, but this could be a very, very valuable benefit for people with early signs of kidney disease. And of course, as you alluded earlier, and we talked a little bit, there are some potential long-term risks as well. We talked about those side effects, and we also mentioned some possibility linking to cancer risk. I would think probably there are four major areas for potential long-term risks we need to be aware of and be mindful and careful about. So one would be the possible cancer link, right? In animal studies, some GLP-1 drugs have been linked to a specific type of thyroid cancer, although this has not been confirmed in humans yet. This is a big concern because cancer is a big deal, right? And there is also some other research looking at a possible connection with other cancers like pancreatic cancer. Again, although no clear link has been found yet. So especially for patients with a family history of thyroid cancer, I would think should definitely discuss this with their doctor before they even start using any of these medications, right? So another category would be bone health, right? You mentioned about muscle health. So some other early studies also suggest that GLP-1 drugs might slightly weaken bones over time, which could increase the risk of fractures, right? Especially in older adults. We know that having one fracture is significantly contributed to mortality in older adults. Right. So that's a big deal, right? So this area is still under study, but it's something definitely to keep in mind. If you are at a risk of osteoporosis already, right? You might want to talk to your doctor about bone health before you consider using this medication. A third category I would consider, which is very much related to digestive issue, especially some of the severe symptoms like pancreatitis, right? And maybe gallbladder issues. So there's a risk of pancreatitis with this, using GLP-1 drugs. Although again, this is relatively rare. It's important to be aware of symptoms like some severe stomach pain or ongoing nausea, which definitely should be reported to your doctor right away if you are using this drug and this happened to you. A third category I would probably call them it's more like it's both a physiological and a psychological effect, right? Because everything you take the drug and everything happen into into your GI system, and it's also a psychological effect, right? So some of the common side effects of using GLP-1 drugs include nausea or stomach upset, and most of them go away fairly quickly, but some of them can persist for some people for a long time, which may make them sticking with the medications really challenge. Additionally, as we talked earlier, because of GLP-1 drugs, they reduce your appetite by interacting with your nerve system, right? Some people may find this potentially affect their relationship with food, especially if they already have a history of eating disorder, right? So this can be, I guess, is both a physiological and a psychological effect, right? So this can be another area that we definitely need to watch for. So in summary, GLP-1 drugs can offer some really beneficial long-term effects, like particularly for blood glucose control, weight control, heart health, and possibly kidney health. However, with any medications, there are risks to consider, right? We're still studying these drugs to understand their full effects, especially on areas like cancer risk, bone health, among many others.
I'm glad we're having this discussion because I doubt that most physicians or healthcare practitioners are going to this detail before they're prescribing this to their patients. And you need to make an informed decision based on the risks versus the benefits. And if the benefits are going to outweigh the risks, then it's usually worth taking it. But if you see that those risks are going to outweigh your benefits, then obviously you would want to choose a different route. What about foods? Are there foods and dietary practices that are known to boost natural GLP-1 production?
This is a wonderful question. So I'm not a big fan of the so-called dietary practices, but I'm a big fan of foods. I love foods, right? So I'm going to stay with the foods. Right? As long as you eat healthy, try to eat healthier as much as possible, it's going to be beneficial for boosting your natural GLP-1 level and helping your overall health, helping your metabolic health. So there are quite a few foods that can really make your natural GLP-1 really more robust, especially improve your metabolic health. For example, high fiber food, right? We already know that foods rich in fiber like whole grains, vegetables, fruits, legumes, they slow digestion. And they stimulate the GLP-1 levels by promoting gut health. And also healthy fats, foods like avocados, nuts, seeds, and olive oil, they can all have this benefit of providing a slow energy release, which can be beneficial for boosting your GLP-1 level as well. Another category, I call this protein-rich foods, right? I love protein. I'm sure you love protein as well. I mean, this is just wonderful micronutrients that your body needs, especially lean protein, such as dairy, eggs, and beans. They support GLP-1 release and helping with the satiety because they also have a lot of fiber as well. And another category, I call this fermented foods, because the probiotics in these fermented foods like yogurt, kefir, and kimchi, they really support GLP-1 by promoting a healthy gut microbiome, right? We all know the importance of a gut microbiome. It's just, nothing can replace that. Another category is kind of related to a healthy fat, omega-3 fatty acids, right? Especially found in fish like salmon or other fish. Now, omega-3 really can also be very beneficial for your GLP-1 levels, increasing your GLP-1 levels, supporting your metabolic health. So in general, incorporating these foods into a balanced diet can support overall natural GLP-1 production and improve your metabolic health.
It makes sense that our body would respond to many of the foods that we're normally eating to produce GLP-1 because that's what it's designed to do, to release that hormone in relation to what foods we're eating. Dr. H, what about lifestyle? Is there any lifestyle behaviors that can complement the effects of GLP-1 agonists?
Yeah, of course. I'm a big fan of lifestyle behaviors, right? I mean, if I have to choose anything or one thing, I want to support my overall health or specifically my metabolic health, I would definitely just choose the lifestyle behavior. I would say a lot of healthy lifestyle behaviors would help and complement the effects of GLP-1 drugs. I mean, I'm sure you heard about the most important 4 pillars for health, right? So just to repeat this, the so-called 4 pillars for health. First will be adequate sleep, right? You need good sleep, support metabolism, and appetite control, right? If you don't sleep well, you won't eat well. I mean, those are very important for enhancing your medication's efficacy as well, right? And second would be balanced diet. Whole foods, especially whole foods rich in fiber, lean protein, and healthy fats, they work really well with the GLP-1 drugs. I mean, they work really well for your overall health as well. Third one would be regular exercise, right? Actually, both aerobic and strength training, they can improve your insulin sensitivity and can enhance GLP-1 drug efficacy as well. It's just very effective, especially high intensity training. So there have been some research, is right after high intensity training, even you eat some high carbohydrate, it's like a very sugar loaded cakes. Your body don't have this much surge of glucose as much as compared to you eat, right after doing nothing. Those exercises very beneficial for controlling your glucose level and enhancing your GLP-1 efficacy. The fourth one would be stress management, right? So we all know the importance of having the proper stress level, right? Too much stress level is not good for your health. Too little stress is not good neither. The mindfulness practices like meditation or yoga can reduce stress, supporting metabolic health. Or if you want to go even further, do some like a Tai Chi or other a moving meditation would be very beneficial for stress as well. It's also a type of movement and exercise. So again, the bottom line is that anything you can do to improve one or more of these 4 areas we talked earlier, adequate sleep, balanced diet, regular exercise, and stress management would generally help your health and help the effects of GLP-1 drugs.
So it sounds like the same things that we want to do in our lifestyle for good health overall is also going to be beneficial for GLP-1 agonists. So what advice would you give to a patient or a provider who may be considering taking a GLP-1 agonist regarding realistic expectations?
Well, this is another wonderful question. I mean, there are a lot of advices I can share. Think about the most important ones. I would say probably there are 3 of them I want to share with people. The first, the mentality is very important here, right? So patients considering GLP-1 drugs, they should be prepared for gradual improvements in weight loss and blood glucose control, right? You can never expect some magic going to happen overnight or over a very short period of time. Might happen for some people, but it won't happen for everyone, right? So this mentality is very important. So expect this going to be happening gradually over a longer period of time. That's actually going to be much more beneficial for you long term. Now, the second thing is that initial side effects are common, but often they decrease as your body adjusts to them. So again, providers should emphasize lifestyle changes, including a balanced diet and exercise, will actually be very beneficial for the long-term goal and will actually maximize the medication's effectiveness, right? So lastly, I would say the regular checkups are very important to monitor progress, manage side effects, and adjust the treatment as necessary. As we talked earlier, there's still a lot of things we need to find out about the potential long-term benefits and the long-term risk as well. And keep in mind, everyone is different. What works well for one person or what happens to one person may or may not happen or work for another person. So it's very important to have this regular checkup, just make sure everything is going well.
That's right. I think you can't just expect something that you've been experiencing for months to overnight change. You generally need to have some time for the body to adjust and get back into homeostasis and to its normal processes. GLP-1 drugs have become very popular lately because celebrities are using them and there's influencers that are praising their benefits. With all of this kind of attention on them, some are looking for natural alternatives that work similarly. And I think that's probably what most people listening to this podcast are wanting to know too, is what are some of the promising ingredients or supplements that mimic the effects of GLP-1 agonists?
Yeah, this is another wonderful question. This is also a very big question. I mean, there's no way I can possibly give a comprehensive list at all, right? But I would say there are quite a few natural alternatives that already show some strong potential for GLP-1-like effects, right? I'm sure everyone heard about berberine, right? Which is commonly touted as a nature's metformin, right? Has been shown to mimic GLP-1 effects, improve insulin sensitivity, and lower blood glucose level, right? I mean, I would say berberine is probably one of the most promising natural alternatives out there in this area. Another one, very popular one would be beta melon, right? This is traditionally used for diabetes management as well. It contains some compounds that may lower blood glucose level and help in weight management. Ginseng, ginseng is wonderful. Everyone loves ginseng, especially Asian populations. Ginseng is a very well-known traditional Chinese medicine as well, right? I mean, it supports metabolism and has some very strong potential effects for, on GLP-1 secretion and GLP-1 activity. Green tea extract, right? So it contains catechins and strong antioxidants that support metabolism and GLP-1 release. It also inhibits ghrelin, GHRERLIN, right? So, which is also known as the so-called hunger hormone. Right. It inhibits ghrelin, so you don't feel that hunger, and it works very much in synergy with the GLP-1 effect as well. There's another thing called we call this gardenia fruit extract, and this is they contain some compounds that support insulin sensitivity and GLP-1 activity. There are actually some studies showing that this gardenia fruit extract actually can stimulate GLP-1 production much stronger than EGCG from green tea leaf extract. So this is really interesting. It's certainly one interesting ingredient to watch out for. So turmeric extract, curcumin, the active compound has a very strong anti-inflammatory properties that may indirectly support GLP-1 release as well, right? And oftentimes we use the turmeric extract combined together with the black pepper extract, just simply because black pepper extract enhances the absorption of curcumin, so it's further aiding the GLP-1 support benefit. Another ingredient which is very interesting in my mind is that we got this fenugreek seed extract. This is also a wonderful traditional ingredient that was known for its glucose lowering property. Some people call this nature's Ozempic because it contains one naturally occurring GLP-1 analog. We call this N55. This analog, just like GLP-1 hormone, it acts upon GLP-1 receptor, induce this response just like natural GLP-1 would do. So it's really it's interesting alternative to look into as well. And of course, everyone heard about chromium. Chromium is an essential mineral that can support your blood sugar regulation and may indirectly support your GLP-1 function. It's a very important essential trace element that forms a compound in the body to enhance the effects of insulin. So, anything that can potentially help your metabolism, help your blood glucose level regulation can possibly interact either directly or indirectly with the GLP-1 pathways, right? One thing to keep in mind is that although these supplements or these alternatives offer some similar benefits, they should be used as part of a much broader and healthier lifestyle approach, as we talked earlier, right? You cannot expect these alternatives or these supplements going to do some magic for you without you doing anything else.
Thank you for emphasizing that, because I know that on my podcast, virtually every episode, we're talking about a healthy lifestyle and the healthy lifestyle behaviors, because that's one of the paradigms that really needs to shift in healthcare in general, is that just take something and we're going to be fixed. That's not how health works. Health requires these foundational things like you've talked about, the 4 pillars. There's other things like reducing toxicity, and there's a lot of things that you need to focus on for a healthy lifestyle in order for the things that you take to work much better. Last question, can you discuss any ongoing research or developments in the field of GLP-1 agonists, including potential new indications or formulations?
There are a lot, actually. Research is exploring new uses for GLP-1 drugs, including kidney protection we touched on earlier on, and the broader cardiovascular benefits, right? I mean, you mentioned some of the other formulation, right? There are also some new drugs that combine GLP-1 drugs with other hormones. So in the hope to enhance effects on not only glucose and weight control, but also other benefits as well. There are also some oral formulations coming up, right? So those oral formulations would be improving patient accessibility, right? Because I don't like needles neither. I don't think anyone likes needles, right? It's like it's much easier to take oral pills compared to get an injection or get. All in all, these advancements may lead to expanded use for GLP-1 drugs in health areas, not only within diabetes and obesity, but also beyond diabetes and obesity. So as far as other research areas, I mean, if you search the website clinicaltrials.gov, everyone knows this is a very well-known public depository for clinical trials register. So there are about 2,000, maybe over 2,000 total studies related to GLP-1. There are about 600 active studies right now. And if you look into the topics for research beyond the current one, right? The current one, we're talking about weight control, we're talking about glucose control. There are a lot of other research areas. For example, just to name a few, like alcohol use, alcohol addiction, right? The mental health, and kidney disease and inflammation, and also pregnancy and PCOS, polycystic ovary syndrome, and Alzheimer's, Parkinson's, and cancers, and other things. So you name it. There's just so many, active topics that completely beyond the current scope, which is diabetes and obesity. I'm really excited to seeing some of the results, and not only about the potential benefits, but also the potential long-term risks and dangers, right? Because we need to be careful with any new drugs, right? And they become so popular, as you touched on earlier, right? It's like millions and millions of people are using it. So we need to be careful with all the side effects and the dangers as much as possible. And of course, I would love to see all the potential benefits as well, especially long-term potential benefits, so the drugs can be used to benefit more and more people.
When you think about how strongly correlated a lot of our health conditions are to our metabolic function, when you could use something that's going to help us better manage our glucose and our satiety and just our overall insulin sensitivity, it makes sense that that could have a broad impact on our health. And so I'm excited about some of these natural options that you've mentioned, and using them as supporting a healthy lifestyle and helping to hopefully reverse or improve some of the conditions that you've mentioned. Well, Dr. H, I think it's been a great conversation, a great discussion. You've shared a lot of information that I think would help people who are maybe considering using these to make an informed decision and maybe even go in more educated as they have a discussion with their physicians. So thank you so much for taking time out of your day to talk to us about this important topic.
Thank you, Dr. Scott. I mean, it's such a fun to talk to your audience and speak with you. I mean, hopefully your audience would learn one thing or two that hopefully they can use for their own health and maybe their friends' health, and to try to spread the word.
Thank you again. Thank you for sharing your time with us today. I hope you've gained insights to elevate your health and life. For more transformative evidence-based wisdom, I invite you to explore my 20-plus books at authorscott.com/shop. Don't miss out on the chance to supercharge your health and guide others to a better life. Like, share, and subscribe to join the movement transforming lives. Here's to your journey toward boundless health and happiness.